In 1998, a team of American doctors and nurses volunteering in the remote village of Mambenkroshu, Haiti, saved the life of a severely burned toddler. 2 years later, a 15-year-old orphan from Papoli, Uganda, who had lost her parents to AIDS, read about the team's efforts and contacted Dr. Sylvia Campbell for help. She had a hole in her heart and could barely walk. The doctors in Uganda told her she would not live unless she had heart surgery. Again, Dr. Campbell's team was able to help and save a life, but this time they were determined to do more.
I mean, doing the surgeries one-on-one, you fix a hernia, you fix something that's broken, you help that one person. But you have to do more than that.
To meet this challenge, work was begun through Papoli Presbyterian Church, and later through the founding of Village Partners International, a nonprofit organization founded to focus on health, education, housing, and entrepreneurship, both in Papoli, Uganda, and Mambenkroshu, Haiti. The stated goal of VPI is to partner with villages for projects that create independence and are self-sustaining.
And when we asked Emma what he needed most in the village that they came from, he said that they needed education for the children, that they needed clean water, and that they needed homes for the widows and child-headed families, because with both the scourge of AIDS and Idi Amin, almost a whole generation had been wiped out.
The results of this partnership have been extraordinary. Since 2001, Papoli Presbyterian Church and Village Partners International have worked with the people of Papoli to build both a primary and secondary school, where the students also receive a nutritious meal every day, 8 deep water wells that have drastically reduced the incidence of waterborne diseases, and 81 houses for widows and child-headed households. And on May 5, 2010, the Robert H. Cooley Pediatric Clinic and Safe House for Children with AIDS opened its doors in Papoli as the first phase in VPI's plan to build a modern medical health center to serve the people of this region of Uganda.
You commit and you continue that commitment, and they know that you're going to continue that commitment. And there's a trust that develops there.
And I see that now, and I see the experience of walking into Papoli and seeing them at the clinic that Village Partners International was built. They're flying an American flag next to the Uganda flag. We didn't raise that flag. We didn't ask them to place it up there. It's their sense that somehow we have reached out in partnership.
The next step in this partnership will be the construction of an outpatient medical clinic to provide the people of Papoli and the surrounding villages with access to adequate health care, as well as prenatal and maternal care. Currently, the closest healthcare facility for adults is reported as overcrowded with no diagnostic capabilities or emergency care, and for many in Papoli it is located too far away to be easily reached, meaning most villagers wait until they are very sick before seeking medical care. The proposed outpatient clinic represents the next phase of VPI's plan to build a modern health center in Papoli, and would result in improved care for pregnant mothers who are at great risk of maternal mortality, would help treat the real threat of malaria, and improve health care for villagers in general, including reducing preventable diseases and ensuring that illnesses are appropriately diagnosed. Additionally, this facility will emphasize cleanliness and good repair, and serve as a model for future facilities. This outpatient clinic will create jobs within the village, help to ensure the safety of community members, and change lives. But in order to achieve this goal, Village Partners International will need help. We are currently trying to raise $60,000, which would fund the construction and complete outfitting of the medical clinic.
I think it's important that we go, whether it's to Uganda or Haiti, to help. I think it's compassionate, and I think they desperately need it. And I think it's both morally incumbent on us as individuals and as churches and as a nation to be reaching out in compassion to those in such desperate need.
The people in Uganda don't want us to do things for them. They want us to help them do things for themselves. And that's an incredible thing. But that's how you truly help somebody.